Good evening, friends. This is Shrenik. I am stage 4 global code cancer survivor, currently in my 28th year on behalf of Indian Cancer Society, Delhi branch, myself, and on behalf of my dear friend and always smiling, competent cancer surgeon, breast cancer surgeon, Dr. Vijay. I welcome you all. When we have a clear purpose, to address the most dreadful and difficult situation for women community. And we have planned this event ahead of time. The month of October is all about breast cancer awareness month. But we don't want to keep things pending for the month of October. And today we have Dr. Vijay from ABSI Cancer Center in Ahmedabad, a commendable human being, always smiling, and only one sentence will be enough for giving his introduction. He has performed more than 10,000 breast cancer surgeries in Ahmedabad. Apart from that, he's a wonderful speaker at national and international conferences. We've given so many research papers, and his specialty is into breast cancer surgeries, lab, and also reconstruction of the breast and other stuffs. And without taking much of the time, I will ask Dr. D.G. Vijay sir to speak, but before that, let me tell you, I had wonderful privilege of having a lunch with him and his wife together in London a few years back, and Quite is always a person ready to support individuals like anything. Sir, welcome on board, and the stage is all yours now.
Thank you, Shrenik Bhai, for having given me this opportunity to be with such a large group of friends on Fridays with Shrenik. I think it's a wonderful series, and you are already conducting this session with various experts, not only on cancer, which is one of the most dreaded disease that we know, but also you also know other experts in heart disease, diabetes. So you could invite them also to speak, and the entire lifestyle of the Indian population can be changed by adopting healthy lifestyles, cancer free lifestyles, and we can all live happy and healthy. So, that introduction, Shrenik Bhai, today's conversation, as I would call it, is all about breast cancer. I am Dr. D.G. Vijay. I am the president of the Association of Breast Surgeons of India. It's the largest body that represents breast cancer surgeons in India. And through this association, we are trying to make attempts to so that we can diagnose early breast cancer in its early stages. So this is part of that initiative to create breast cancer awareness. So this is our outreach program to the public. Secondly, we also train general surgeons on how to perform the surgery correctly. As you heard, I have about 30 years of experience of doing breast cancer surgery. So, with that experience, it is now my duty to train other surgeons so that they can do breast cancer surgery competently without doing any injustice to the patient. Third, we are a team of breast cancer experts at the top of the association who also do very advanced procedures, which we will discuss through our conversation. If you have any questions, you can send them to Shrenik Bhai or to Vaishali or post them in the chat box. And I will be very happy to answer them either during the talk or at the end of it. So why this conversation at all? So October is the International Breast Cancer Awareness Month, as you all know, and I'm fairly busy in that month. And so Shrenik Bhai requested if we could do this event a few days before, then we can probably reach out to a lot of people. And as you also know, we are very busy in Gujarat in October with Navratri in the starting and Diwali in the end of that month. So I think this is the most appropriate time. And for a change, the weather in Ahmedabad is also excellent. And for those of you who have not come to Ahmedabad, you can be the guest of Shrenik Bhai or my guest, and we will be more than happy to host you during the Navratri. So, with that, India sees in India, we see about more than 2 lakh new cases of breast cancer every year. So, it's a huge public health problem. It's a huge burden that so many women of our country are suffering from breast cancer every year. Unfortunately, nearly 50 to 60% of them are still diagnosed in stage 3 and stage 4. And therefore, the breast cancer mortality in India is nearly 50%. So 50% of all women diagnosed with breast cancer, unfortunately, are going to die. So it is very important for women to be breast aware. They should be aware of the changes taking place. If they can come to the medical facility early, then we will be able to save these women. Ultimately, as you know, women are wives, mothers, sisters, daughters, and they have multiple roles to play, and office goers, bankers, teachers. So it's very important that women be breast aware and they come to the medical facility early. So approximately 1 in 24 women is likely to get diagnosed with breast cancer. So if you have been diagnosed with breast cancer, it's most probably an accident. So 1 in 24 women are likely to develop breast cancer. Why they develop, I'm going to discuss some of, you said that I must discuss the risk factors. I am going to discuss the risk factors, but in an individual case, we do not know what is the exact cause why she has developed breast cancer. Therefore, you all must be, even if you don't have a family history, even if you don't have any risk factor, it's very important that you must be aware of the changes taking place in your own breast. Now, coming to the risk factors. The general risk factors for breast cancer is that there is some sort of hormone overexposure, estrogen. So either it could be early menarche, by which we mean that the girl has started having her periods at an early age, late menopause, where the menopause comes, the menstruation continues and menopause comes at a very late stage. The previous generation of oral contraceptive pills were incriminated in the causation of breast cancer. Hormone replacement therapy is one more reason which could probably increase the risk of breast cancer. Breastfeeding is protective. So nature wants women to marry early, have lots of children, breastfeed them. But that is not possible in today's world. So breastfeeding for at least 6 months to 1 year is a protective factor in the causing of breast cancer. It's a protective factor. It reduces your risk. So these are some of the hormonal reasons. Diet, of course, is a major reason. Diet rich in non-vegetarian food and fatty foods, alcohol, and these are some of the reasons where diet could also play a role. One of the risk factors that has clearly been identified is obesity. So as the body mass index of the woman increases, her chances of getting breast cancer increases. I mean, there is no absolute linear relationship that as a woman gets, obese and obese, her risk increases. So we have to maintain a healthy lifestyle and try to achieve ideal body weight. As you age, so uh, the peak incidence of breast cancer is generally 1 decade less than that in other countries. In the US and Europe, the peak incidence is around the fifth and the sixth decade. Unfortunately, in India, it is the peak incidence of breast cancer is in the fourth decade, when the woman is at her most productive maximum. That is when her son is going to standard 12. That is when her daughter is going to get married next year. That is when her family has, achieved a certain amount of success and she is just getting ready to enjoy the fruits of her labor, which she has done for so many years. And that is when, at the age of 40, 42, 45, she is diagnosed with breast cancer. And, it's a major shock, not only to her, but to her family. Having said that, in my experiences abroad and here, the family support that women get in India is outstanding. The complete family, drops everything and they support the woman in her fight against breast cancer. They are with her from day one, and during all the treatments, they not only support her emotionally, financially, and in every other way that the family can support. Different people may have different resources, but in spite of that, the Great Indian Family is a major support to breast cancer patients in India. Let me tell you one last thing, that is gender. So very often I have been asked whether men can develop breast cancer. So men also have small breasts and they can develop breast cancer. But the incidence of breast cancer in men is very, very low. So of all the cancers that occur in men, breast cancer accounts only for 1% of all cancers. So men are more likely to have oral cancer, lung cancer, esophageal, colon, prostate, etc. And breast cancer will make only 1%. For 99 women or 100 women diagnosed with breast cancer, one man is likely to develop male breast cancer. Again, the reasons for that are not very well identified, but the same risk factors that hold true for women are also true for men. These are some of the generally identified risk factors for breast cancer. There is also a lot of discussion on hereditary breast cancer because very often we are asked that हमारे घर में तो किसी को ब्रेस्ट कैंसर नहीं था, तो मैंने सोचा कि ये गठान कैंसर की नहीं हो सकती, वो सादी गठान हो सकती है, दूध की गठान हो सकती है, या थोड़े 2-3 मेंस्ट्रुअल साइकिल्स में चली जाएगी. But friends, let me tell you that hereditary or familial breast cancer is only about 5 to 10% of all breast cancer. बहुत सारे जीन्स ऐसे आइडेंटिफाई हुए हैं जिनकी वजह से उनके मदर में से या फादर में से उस महिला में वो इफ दैट जीन इज ट्रांसमिटेड, then there is a high chance that she will develop breast cancer. So the most common genes identified are BRCA1, BRCA1, BRCA2, BRCA2. These are the two most commonly identified genes. Besides that, there is a whole panel of 8 to 10 genes commonly known. If they are transmitted, then the risk of developing breast cancer in that woman's lifetime is high. You all know the incidence of Angelina Jolie, where her mother and a lot of her other relatives on her mother's side developed breast and or ovarian cancer. So when Angelina Jolie was tested for that particular BRCA gene, she tested positive. So she decided if how to prevent breast cancer. So she went to one of the best cancer experts in the USA, who is fortunately known to me. And there she decided to get both her breasts removed. So I think it will be, there were some suggestions that we discuss the causes again, but as I told you, age at, otherwise I'll be repeating the same thing over and over again. Age at first birth, late menarche, early menarche, late menopause, diet, hormonal factors, oral contraceptive pills, hormone replacement therapy, breastfeeding, and these are genetics, obesity. These are some of the well-known incriminating causing factors for breast cancer. We were also discussing about hereditary breast cancer in Angelina Jolie. With that, breast cancer is breastfeeding is protective because the change that takes place, the hormonal changes that take place within a woman during breastfeeding, the estrogens go down and the protective hormone progesterone plays a major role. So that is the reason why women tend to be protected during breastfeeding. But having said that, some women can even develop breast cancer even when they are, lactating. So the gynecologist, you have to be aware. Now, the purpose of this meeting is also to put the facts in perspective. 9 out of 10 breast lumps are benign. So it is for the expert to decide which are the 9 which are benign and which is the one lump that could be malignant. Therefore, especially when you feel a lump in the breast, it is important that you seek medical attention and let the doctor decide either by clinical examination or by doing a sonography or by doing a mammography or sometimes even a biopsy to decide whether it is benign or malignant. If it is a benign lump, in most of the cases, nothing needs to be done. Many women will know that they will be suffering from a condition which is called as fibrocystic breast condition. In that, simple water-filled cysts are formed before the periods. They can be there after the periods also. They cause a lot of pain, but they are not a very major risk factor for breast cancer. Many women will also have benign lumps, just the way you have fibroids in the uterus, you can have a fibroadenoma in the breast, which is also a benign tumor. It cannot get converted from a benign fibroadenoma to a malignant cancer. So there is no reason to worry if you have any benign disease in the breast. Many women also have nipple discharge. The signs of breast cancer are lump in the breast, lump in the armpit, skin changes over the breast, and nipple discharge. Most of the time, the nipple discharge is bloody, by which we mean it is blood stained or it is clear, watery in nature. Now, many women will interpret this as that all nipple discharges are probably malignant. But if you can take it on a white cloth, the nipple discharge, you will find that most of the time it is either black or brown or greenish in color, and that is not a sign of breast cancer. However, you should consult a doctor and get the appropriate investigations done and be assured that you are not suffering from cancer. Let me repeat the symptoms once again. Lump in the breast, any changes occurring in the breast, nipple discharge, lump in the armpits, and skin changes. These are some of the common local signs of breast cancer. To detect breast cancer early, you have to be breast aware. So every month after your periods are over, 7 to 10 days after that, with the right hand, you can feel the left breast, and with the left hand, you can feel the right breast. keeping the hand flat like this, and look for any lumpiness or any changes that are occurring in your own breast and in the armpits, and press the nipple and see whether any. But this exercise of breast self examination has to be done just once in a month. If you become very afraid and start doing it every day, then you will start seeing all sorts of changes and you will become very nervous. So it is important to do it once in a month. If you notice any changes, there is no need to see a breast cancer specialist. You can go to your local family physician or your gynecologist. Uh, as I whenever you go for any clinical examination, so if you as a you go to a family physician for fever, now this season we are seeing a lot of viral fever. So in case after the viral fever is over, you can go and ask for a breast examination by the nurse or the doctor. So that is also possible. Or if you go to your gynecologist for some other, vaginal discharge or any pelvic pain or any other gynec related problem or obstetric related problem, at that time also you should get once a year a breast examination by the clinician, by which we mean a doctor. And those women who are beyond the age of 40 should start getting their mammograms. So if they are at low risk, there is no family history, etc., they can certainly get it done once in 2 years. And if they have any risk factor, then they can get it done every year. Vaishali, if you can go through the chat box and if there are any interesting questions, then we can take them now or we can probably take it at the end of the talk. So, unfortunately, if a woman is diagnosed with breast cancer, there is often a lump. The way to diagnosis is mammography has to be done, sonography of the breast has to be done, a biopsy has to be done. Women coming from rural villages are afraid that by doing a biopsy, the disease will spread. But that is not true. All breast cancers need to undergo a core needle biopsy, and the tissue has to be submitted to the lab for examination. And based on that, we also do some other blood tests, X-ray, ultrasound of the abdomen and pelvis, and find out, and then offer treatment. So we are now coming to the treatment part of the breast cancer. The most effective treatment for breast cancer is surgery. So if it is in an early stages, small tumor, then very often we offer surgery to these patients. It is important to diagnose breast cancer in the early stages because if the tumor is small and the breast is big, in about 50% of cases, we are able to save the breast, by which I mean we need to remove only the lump. So we need not remove the entire breast. Just So we need not remove the entire breast. We need to remove only the lump. Previously, about 20, 30 years ago, we were removing the breast in all cases, by which we were calling it as a mastectomy. So even today, in some about 40, 50% of cases, for some technical reasons, we might have to remove the breast. But in about 50% of cases, we can save the breast. Now, so that the disease does not come back anywhere in the body, we need to give some systemic treatment. There are various systemic treatments, the most feared of which is chemotherapy. Women are really afraid of chemotherapy. The main reason is that because they lose their hair. Hair loss or alopecia is a major side effect of breast cancer chemotherapy. So a woman who is about 40, 50 years old, losing her hair, all the neighbors will come to know and they will ask all sorts of inconvenient questions, uncomfortable questions. So they certainly want. So in some chemotherapies at HCG Asta Cancer Center, we have what is called as a scalp cooling device. It's like wearing a cap, scalp cooling cap, and that prevents hair loss in some types of chemotherapies. Up to 70 to 80% hair loss can be prevented in some form of chemotherapy only, and not in all types. This you will have to discuss with your cancer physician. The other type of treatment is hormone therapy, where we give tablets for 5 to 10 years to prevent the disease from coming back. More recent advances are there is a gene called HER2. So anti-HER2 treatment can also be given. Immunotherapy is a major role. Nowadays, for surgery, in when we are planning reconstruction, we sometimes have we are using cancer surgery and then doing the reconstruction. At this point, let me tell you two sentences about reconstruction. So many women who undergo mastectomy would want to undergo a reconstruction. Shrenik bhai, the voice is clear? Okay. So reconstruction can be done in two ways. One is using a silicone implant. So especially when we are doing bilateral breast reconstruction, we use silicone implant, which is a very easy way of reconstructing the breast. And that gives excellent cosmetic outcome and matches the other breast in terms of projection, ptosis, drop, everything will look very, very similar to the opposite side breast. But if you are removing both the breasts, then you can put similar sized silicone implants on both the sides and then achieve very good cosmetic results. In some conditions, we use the body tissue itself. The the site which is most helpful for harvesting this tissue is the belly fat. So women have a lot of belly fat, so that belly fat can be transplanted from the belly over here and to the chest wall, and by a process which is called microvascular reconstruction, the artery is joined, the veins are joined, the skin is joined, and it is like a transplant surgery. So instead of one man giving a kidney to another man, here it is an autologous where the body itself donates its excess fat over the belly for use for breast reconstruction, and the patient gets a free tummy tuck. So where her belly is hanging, so there it becomes very flat. So this is regarding the treatment, regarding surgery, chemotherapy, reconstruction, and in indications we also need to give them radiotherapy. Again, there are the radiotherapy machines have become very sophisticated, very precise, very targeted, and therefore the side effects of radiation are also very, very minimal. Eventually, breast because breast cancer patients, lot of research is taking place in breast cancer patients. Patients are living longer and longer, and they are emerging as winners. So the entire focus of breast cancer research and treatment today has shifted to quality of life, where we just don't want women to survive. We also want them to thrive, by which we mean that we want to give them an excellent quality of life. So whatever they were doing before the diagnosis of breast cancer, there should be no restriction in their quality of life. They can do everything. Like Shrenik Bhai does everything after his cancer treatment. We want our women also to, travel across the world, travel across India, go to hill stations, go to the beaches, go to the office, work, teachers, principals, bank, government offices. So we have so many doctors who are breast cancer patients who are now paying back to society because they have, they're redeemed their full worth. So these are some of the at HCG Asta Cancer Center. We have a special breast Yeah. Shrenik bhai, you wanted to say something? We have
You
a very
continue.
Yeah, we have a very strong group of specialists. We have a cancer physician. We have a radiation oncologist. So we all sit together and discuss these cases. We have a physiotherapist who does lymphedema exercises. Some women who develop lymphedema, so their treatment also can be done in that group. We have a special breast cancer dietitian. We have a genetic counselor who counsels patients for breast cancer, uh, a plastic surgeon, a reconstructive surgeon who counsels patients for breast reconstruction. So these are all part of the group who help us to give better and better results in breast cancer treatment. We also have patient counselors, women who have been cured of breast cancer, breast cancer support group. So when a woman is diagnosed with breast cancer, it is a very traumatic situation for her. But when she sees another woman alive at the end of 5, 10, 20 years who has gone through the same process that she had undergone, then she feels very confident that she will also be able to sail through this very smoothly. And maybe in 2034 or 2040, she will be the torch bearer explaining about breast cancer treatment to someone else, what we call as Jot se Jot Jalao. So it is one woman who was treated 20 years ago. Now she will come to the OPD on Thursday and then explain to another woman that, look, I was in your seat yesterday. I was also crying. I was also upset. But because of good treatment, good stage, good treatment, the disease is cured. And that woman gains confidence. She participates in the decision making. She understands everything. And having taken an informed decision and the right choice, she has access to the best treatments in the world. Anything else? I think I've been speaking for such a long time. Um, you have been a wonderful audience, and we can go through some of the questions that Vaishali has, and I will be more than happy to answer them.
Yes, sir. We have
Uh,
many questions in the chat box. So I would like to ask you now. Uh, Sir, there is one question. Give what are the current therapies available? What are the major factors that causes breast cancer? Major factors.
So major factors we have already discussed before. So hormonal factors are the main factors. Young age, when you have your first periods, late menopause, lack of breastfeeding, hormonal hormone replacement therapy. These are all, but they cannot be 100% sure that if you don't do this or do this, then and some of these factors cannot be modified. So at the age at which you will have your first periods, you cannot modify. The age at which you will have menopause, you cannot modify. So some are modifiable factors by which we can have a healthy diet, exercise regularly, avoid alcohol and non-vegetarian food, not avoid altogether, but take it in moderation. Maintain an healthy body mass index. Obesity is a major reason for breast cancer. Obesity is a major reason for many cancers, many lifestyle diseases, including diabetes, hypertension, um, heart disease. Your joints could get, degenerated because of the weight. So all these are important symptoms. So lifestyle changes that you should make in the able to modify your risk. There is no way to prevent breast cancer. What you can do is early detection. Go for regular health checkups, full body checkup, X-ray, ultrasound, mammography. For men, there is PSA. You keep doing this, you are likely to detect breast cancer early. I think there is a small role of yoga and all these other supplementaries and other therapies also, because they seem to calm the mind. And maybe at a research is going on in many cancer institutes about the role of yoga also in preventing, and also helping cancer patients. So many of these Indian sort of therapies and treatments that are there, whether it is Ayurveda or yoga or homeopathy, they may have a role, but currently there is not strong evidence to recommend it as part of the treatment. But ultimately, it is all about breast. We need a healthy lifestyle.
And sir, there is another question from Mrs. Renuka Prasad, that how to prevent recurrence. Telltale signs, please.
So there is no way the patient can do to prevent recurrence of breast cancer. So it is very important, very, very important, very, very, very important that when the cancer is diagnosed for the first time, it is diagnosed in an early stage. So if you are stage 1, then your chances of cure are 90 to 95%. Your chances of recurrence are only 5% to 10%. But if you are stage 3, then your chances of cure are about 60 to 70%. And chances of recurrence are 30%. You understand? So it is very important that more and more women come to us in stage 1 rather than in stage 3, where the chances of recurrence are going to be high. The signs of recurrence could be, on the chest wall itself, you could start developing nodules. You could have cough, by which the disease could have gone to the lungs. You could have headache, by which the disease could have gone to the brain. You could have bone pains, or a fracture, by which the disease could have gone to the bones. You could have loss of appetite or swelling of the stomach, by which the disease would have gone to the liver. So these are some of the common sites of metastasis and recurrence.
Thank you, sir. And sir, there is a compliment from Varsha Panwar. Your method of explaining concept is different, which makes the class very interesting. These are the
Thank you.
comments from YouTube.
Thank you.
Let me tell to all entire audience, we are doing our best to bring the top of the highly experienced oncologists to our session every Friday. So try to join. I mean, not only for this breast cancer awareness, but all other types of cancer as well. Sir, I have one request. Saying the today's attendance and particularly while addressing or rather saving the future of women, particularly in cancer. May I request your one more session on 18th of October, because I mean there are too many individuals. Someone might have missed this session, and so we would love to have you once again on 18th. That is Friday, 18th of October, and I mean I'm sure કે તમે ના નહીં પાડો.
I'm traveling on the first and second week of October for an international meeting, but I promise that once I come back from Europe, then I will certainly want to participate. I hope all participants enjoyed. I hope it was very informative. We wanted to create awareness about breast cancer. So there is a last take-home message that breast cancer is certainly curable. We need to detect it early. In all cases, we need not remove the whole breast. We can only remove the lump. In some cases, we can even avoid chemotherapy. We can avoid radiation. We can just give them hormonal tablets. And it's very important that when you have your family members also, your sister, your neighbors, they all go for getting a mammogram done. And that is how society benefits from, it is unfortunately one person's tragedy that she has breast cancer. But let us learn from that. and get mammograms for our own family members, our neighbors, our friends. And that's the way forward, I think. Thank you.
So, uh,
Thank you,
I
doctor.
love it.
Sorry, Shrenik sir. We also have some queries from YouTube, and I will ask you in a few minutes as I receive them. Will it be okay?
Yeah.
So, friends, we have brought, rather, we are having a privilege of bringing Dr. Teacher Vijay for sharing the knowledge. Say whatever it's you won't be able to get a kind of a personalized somewhat or personalized assistance in terms of breast cancer awareness and treatment protocols, etc. So, uh, as I mentioned, as I requested Dr. DG Vijay, we will be planning one more session on the same line in the next month. We will keep you updated over social media platforms to join us. And one of the key reasons of doing such webinar is like so many informations and details are available on a web browsers. But if you are not qualified as a medical professional, I mean, better to contact the medical professionals instead of becoming self doctor without having qualification, as you are gambling with your own health. So don't do that, and that is one of the key reason, key purpose we are rather conducting such kind of webinars for knowledge sharing with everyone. Yeah. Uh, Yes, I'm done from my side, and Vaishali, you continue.
So the YouTube participants have the same questions that they have in Zoom with us, and we have covered that about metastasis, that from one organ to another, how can it spread, and how can we prevent it if we detect it at early stage. Also, there is another same that how can we reduce breast cancer to happen.
There is no way. It is a disease of the modern lifestyle. So the numbers are probably going to increase, not decrease. You cannot reduce the incidence of breast cancer. You only can detect it early. So when I started my career about 3 decades ago, the number of breast cancers that we used to see in the country was very few. Now we see more than, these are 2 lakh reported cases. In India, all statistics are so hard to find, there will be lot of cases which are unreported. So it's really a very big number. You cannot prevent breast cancer. You need to just have a healthy lifestyle, regular checkups, and early detection. These are the key to managing breast cancer in India.
Vaishali, is there anything pending now?
Yes, sir. I think that is all about. This is the only questions we have for the session. Thank you,
Great.
doctor, for
Thank
Uh,
you.
the questions,
Thank
and we
you.
have taken a lot of your time. And the session was amazing, sir. The way you were teaching, even participants find it very interesting.
Thank you.
uh,
Sir,
Vaishali,
also, we have a person who has raised their hand, Tamanna. So, if you can answer their question, I'm going to unmute them. Will it be okay, sir?
Yeah.
Tamanna, please ask your question.
Yes. Hello.
Hello.
Hello. What diet we should say? I'm a cancer survivor. What diet we should take?
There is no specified diet that can be described as anti-cancer or will reduce your chances. My understanding of diet is that it has to be a simple, healthy diet, low in calories, rich, the usual, rich in vegetables and fruits, more of milk and paneer. And if you are eating non-vegetarian food, maybe once a week. I am not against in Gujarat, of course, we have prohibition, but in other states where some women might want to take alcohol, so even that is not, nothing is restricted. Like the great Gautam Buddha said, live
No, I
life
don't
in.
take alcohol.
No, I'm not asking you to take alcohol. So those who are taking in Bombay, and if they want to take, they can take. So, like the great Gautam Buddha said, ultimately, life is all about moderation. So many of the Indian spices and turmeric and many of those things are protective, but we have no proof now. So whatever is our regular, what we call as the Indian thali diet, is a healthy diet. It contains the right amount of proteins, antioxidants, carbohydrates, and fats. So everything in moderation, perfectly allowed. Over festivals, I think you can continue now that Navratri is going to come and then Diwali. We in Gujarat love our sweets, but then everything has to be in moderation. So as long as you live back. One of my favorite dietitian
Can
is,
we
of course,
eat wheat and rice?
you can eat whatever you want, but as long as you don't gain weight and small quantities of everything is healthy. There is no that diet is going to cause cancer. Yeah. Thank you. I think with that,
Thank
we
you
can
very
come
much.
to the conclusion of today's meeting. Thank you, Shrenik Bhai. Thank you,
Thank you. It
Vaishali.
was an excellent session.
Thank you very much.
Excellent session, sir.
Sir, on behalf of you, Vijay, Indian Cancer Society, I wish everyone happy Navratri in advance, and we look forward to having you back in the coming month. Thank you so very much, and sir, I owe you for today's session. I owe you Gujarati Thali for sure. Thank you. Thank you very much.
Thank you, doctor. Thank you, Shrenik sir.
Sir, you are muted. All right.
Thank you.
Thank you.
Bye-bye.
Hey, everyone.
Bye. Bye.
Bye-bye.
Bye, everyone. Bye.
Thank you. Thank you. Thank you so much.